Hello, I'm Mark Adams. I'm Joint Director of Public Health for Middlesbrough and Redcar Cleveland, and I wanted to talk to you today about the COVID situation in Middlesbrough and Redcar Cleveland. What we've seen over the last 3 weeks is that the numbers in both areas have gone up by a factor of 10, from between 20 and 30 cases per 100,000 to between just under 200 to just under 300 cases per 100,000, which is a significant rise, a significant concern. And what we're seeing in both areas is cases are everywhere. They're all across both boroughs. There's no particular clustering that we're seeing. There's no particular settings that we're seeing as being places of concern, although there are some settings that are potentially causing spread to happen. And I think that the seriousness locally is really important. We're starting to see hospitals being under increasing pressure. We've got inpatients with COVID-19. James Cook Hospital had to open a second inpatient ward just recently. We're seeing patients on critical care with COVID, and we're seeing patients needing to be ventilated because of their illness. And I think in terms of the restrictions, I know that they can be very confusing, and I know that they can cause difficulties when applied to real life and applied to family situations. In essence, they aim to enforce hands, face, space. So I think that message is the same, has been the same all the way through. Wash your hands, cover your face when you're out, particularly when you're on public transport or inside shops or public buildings, and keep your distance from other people. Reduce the amount of contacts that you have will stop you getting infected, and if you are infected, will stop you infecting other people. And I think the critical point is that we've all done so much to get to where we are now, and if we're going to avoid what we saw previously in March and April and May, when we were so badly affected in terms of illness and mortality from COVID, and we all have to work together to try to prevent the spread of this horrible virus and get back to some sort of normality. Thank you.